welcome to Bite Size Dental Marketing. Erin, it's 2025. It's mid-February, early Feb. And this is the first episode I'm recording. I've taken a little break. I was really excited when Katie and Andre lined this up for us to meet. I'm kicking off season 3 now. I think, north of 100 episodes. And so I'm excited to have you on as the first guest of 2025. But I want to jump right in. Dental recruiters, it's in the name. I have some idea of what you do. You're out of Minneapolis, which is lovely. We were just talking about what a great place it is to raise a family.
Yes.
Tell me the journey you've gone on to, how the heck, who wakes up one day and says, I really love recruiting. I'm gonna go recruit.
Yeah.
I had a buddy that went to Harvard. I went to UTA. It's not the same, but he said I can distill down a Harvard education in 2 sentences. Market friction is market opportunity. And I thought that was, well said, but it's probably a good time to be recruiting. At the same time, it's challenging, but give me the backstory. Where's Erin been?
Yeah. So thank you for having me. Of course, I'm glad to be the first one in 2025, but yeah, so I'm a licensed dental hygienist. I graduated from the University of Minnesota School of Dentistry with a degree in dental hygiene. Right after graduation, I moved to North Carolina. My husband was in the military and was stationed there at the time. So I practiced both as a clinical dental hygienist, and then I was also working in front office operations. After a couple of years of that, we moved to Texas, where I practiced both as a full-time clinical hygienist. And then, so back in 2018, we moved back home to Minnesota. Minnesota's home. I spent a few more years practicing in private practice. Then I transitioned into more of a lead front office position where I managed everything from business reports and money and insurance, and patient communications. And it really gave me that diverse perspective on both the front and the back office of a dental practice. Then a couple years ago, Shannon and I connected. We actually were at the same school of dentistry. She was just kind of a year ahead of me. So we had known each other for a while. But so she owns dental recruiters. Her and I connected because she's looking for someone to run her dental recruiters company. It was a recruiting and a temporary staffing company at the time. And then just over a year ago, we rebranded and shifted our focus entirely on full cycle permanent recruitment for private dental practices. And I love it. I have both the clinical background as well as the business mindset to help practices succeed with a permanent team.
If you look at the market today versus a year ago versus maybe 5 years ago, what are you seeing out there
as far as kind of what jobs are looking like?
Yeah, what jobs are looking like, what compensation is looking like, what are you seeing these offices do?
Yeah. And that has been the biggest shift, I feel like, especially since COVID. Ultimately, compensation is always going to be a big piece that grabs people's attention when it comes to applying for a position. So my job at Dental Recruiters is really to give a different balance, to kind of to balance that compensation strain. So sky high hourly rates have gotten extremely high over the recent years, but where's the ceiling? Eventually, right now we're seeing average of $55 an hour for hygienists in the Twin Cities when reimbursements don't change and, everything else just doesn't change as far as expenses in a dental practice. Where's that ceiling where eventually it's not reasonable. It doesn't make sense. So what we're seeing and what we really talk about, I know Shannon touched on this with you when she spoke not too long ago, but many of our practices that we're working with are incorporating a hygiene compensation model. Ultimately, it's the idea of associate dentists are getting paid a percentage of their production. Right now, dental hygienists are doing more than they ever have. So, they're doing, of course, scaling and root planing, laser treatments, prophies, increased sealants and fluoride, but also Botox now is in the mix where hygienists can go in and, ultimately mark all the places. Doctors just have to come in and inject. So they're doing more than they ever have. So that being said too, they can be compensated similar to a dentist as well. Where it's different is they're not paid entirely off of a compensation,
Right.
off of production, I should say. Hygienists receive a reasonable base pay. That's where it can kind of stay within reasonable area for practices to manage. But then the ceiling is theirs to achieve. So this doesn't mean that dental hygienists recommend anything that's beyond their scope of practice, or that they should recommend any treatment that's not necessary, but it helps ease the blow for practices that are just paying the base rate.
Right.
So, ultimately you don't want a hygienist that's just doing prophies day in and day out and still get this base pay and there's no extra production coming in. But so that's also where we recommend, implementing other benefits as well that can attract candidates besides compensation, right? So this is where we get into welcome bonuses. And that can be paid, a lot of people see welcome bonuses and they're like, well, I'm not going to pay $5,000 for a hygienist. And then they're a week in and say, thanks for the free money. Bye. And that's more, we work with them about what does that look like? How can that get paid out throughout the course of how much time? But, that's an option. Holiday pay, including floating holidays, PTO, medical, dental, those typical benefits, but also just some fun out of the box benefits, such as a fun one that we'll see or use, I should say, every once in a while is having your birthday as a paid holiday, or, reimbursement. If you have a decent commute to work, could we reimburse mileage and gas money? So kind of some out of the box things to try to consider too.
So I have a question for you. And, I feel old enough to ask this question. If your paradigm is, I used to pay my hygienist $28 an hour, $32 an hour, for whatever the number, 35, sure. And now it's 55 and they want more freedom. That's a lot. If I've only ever done it one way, it just sounds like anarchy, right? Yep. Like I'm just giving away money, because even the bonus, I'm giving away money. If I'm giving them their birthday off, I'm paying them, but I'm not getting their production. It all wraps up into just more money, right? It's some money and freedom. But culturally, that sounds, if I'm only ever paying $35 an hour, and if you're here, I pay you. If you're not here, I pay you. That's such a huge gap. And I acknowledge that that's an old way of thinking, but still, it begs the question of how do you culturally help that doctor bridge that gap to today, right?
Right. And that's the $1 million question too, is how can we get doctors and practice managers on board with this whole, what else besides just throwing money out? So yes, of course, benefits are money, PTO is money, holidays are money, welcome bonuses, all that. But ultimately, how can we balance that where let's get these good team members for you that have the same views, same, drive for patient care, where they can ultimately have you produce more as a practice, where it doesn't seem like it's, oh my gosh, I'm losing all this money. More so, okay, well, this is how we treatment plan. This is how we care for our patients. Here's our philosophy. And then if we can get everybody on their team on board with that, which is the ultimate goal, and ultimately that gap won't seem as like, well, we're just going to keep downing money.
Right. So the argument then, sort of, if I'm distilling down what you're saying, is yes, you are going to outlay more cash. And however, the cash you outlay is going to be furthered by an increase in your hygiene production, perhaps your same day dentistry. You are going to see a corresponding rise in overall P&L health of the organization.
Correct. And the same thing, I mean, even, insurance reimbursements, that's kind of been a sticky situation too. But ultimately, the baseline of fee for service for an exam or a cleaning or all that's naturally increasing, rates increase usually annually, give or take, as well. So there's that theory too.
Yeah. I say only purposefully, if you only view hygiene as a place where cleanings happen, then this is a major mind shift for you. Because when I hear you talk, it's less about just paying more money to keep a hygienist. And if you view that way, you're probably coming at it from a very not an abundant mindset, right?
Correct. Very
But
linear.
if you're very linear, right? But if you view it as, you know what, I'm going to turn my hygiene into a revenue center and treat it as such and have goals as such, I can now see where I can go from just cleanings to it being a revenue
Correct.
center to give them. Yeah. And
Correct. Yes. And exactly. And that's just it, is you don't want to bring on a team member that's just in that mindset, of, well, what do you mean? I just want hour-long profies 4 days a week for, like, that's all I want. What do you mean? Kind of a thing. So that's where it can be more of a harder shift. But then that's kind of where, I come in and it's like, okay, hear me out. Like, it seems aggressive, but we're attracting these people. It's like, okay, like, prove it. We'll give you all these things. We'll do all these things, but like, prove that you value our patients and our, everything the way that we do. And you care, I care. So yeah, I think it's just shifting that mindset, which, I speak with a lot of colleges too, and just kind of, hey, it's not just a go in, and I still actively practice every once in a while too. And there's plenty of times where I'll go in and I'll see patients and I'm like, man, there's so much that's just getting like, oh, well, we'll catch it next time. We'll catch it next time. Or, where there's so much room for kind of better provider relationship too.
Right. Now, I have a question. One time left my cable company, obviously a long time ago when I had cable, because they were
Right.
offering new people. Yeah, it was forever ago. If you signed up new, you got 6 months for free, but they wouldn't give me 6 months for free. And I've been around for a long time. Now flip that on the hygiene side. How are you handling? I have 3 hygienists and now I'm hiring a new one they're coming in at a much higher rate. I'm having to advertise at a higher rate. Like, how am I bridging that gap in the organization of if someone's coming in at $55 an hour and my God, no one makes 55, how are you doing that?
That's a great question, because that is a very common question I get. And ultimately, what I recommend and suggest is, before we even get an ad out there, because that's your worst nightmare, where you have this ad, it's all these extravagant promises.
You
and
can
then
have your birthday off and you
right.
can,
And like, you're the current,
and Fridays are free and
yeah,
everyone's
like,
like,
coffee's
whoa.
Monday, like, yeah.
Yeah.
and then you're the, hygienist or assistant or whatever, and all of a sudden you're scrolling and being like, wait a second, this is my practice.
I would like to apply for that job.
Correct. I would want that. So what we recommend is, of course, obviously and ultimately, if you are going to post an ad with A, B, and C, your current team, you need to match that. And that kind of goes into where, ultimately, if this is the vibe and the kind of feel that you're going to give out to a new applicant, like, you're all right, yes, this is why you should work for us. This is why you should come in and pick us above all the other hundreds of offices that are looking for the exact same candidate. That's where it comes into, yes, you need to adjust those benefits for the whole office. That I get that question a lot too, with, of course, compensation, but medical insurance. Okay, well, nobody in my practice needs medical insurance. I don't want to have to offer it to everybody. Well, I mean, it's kind of going to come with the territory. But that being said too, how do you keep your current team retained and staying? And, you want to just ultimately create that environment where you want to attract candidates, but you want to not only retain them, you want to retain your current team. So that's where, yes, you want to make a great first impression when they come in for an in-person interview. But let's say, a practice needs to set up that ambiance that they can continue for everybody else. Is it well organized? Do you have fresh flowers? Do you have refreshments? I've even seen where there's massage chairs in the break room, like, just something that, what makes your culture and team stand out, and where the rest of your team also feels just as honored to work there as you're trying to pursue this next person.
I hate to be the middle-aged, man in the room, but I am now most days. It's wild. And I find myself, Erin, caught sometimes between, I'll give you an example. And my kids are not old. They're 12, 13, 14 now. So they are not old, right? I mean, this is a relevant within the last 15-year story.
Yeah.
I remember I worked at a large company and I told my manager that my wife was, we're having kids. It was our second, it wasn't, and I was going to take some time off to bring Sophia home.
Yeah.
And he giggled and he's like, you don't have breasts and you ain't helping. What are you going to be doing? And
Mhm.
this was not a bad man. This was not a
Right.
crazy man. He
It was a
wasn't,
valid question at the
he,
time. Yep.
he wasn't mean, and he giggled and denied my time off to be there. It feels very jarring for me to now fast forward to 2025, and I'm giving people their birthday off
Mhm.
without it being a day. I'm unlimited leave is more common than not some places. I'm
Yeah.
now having to adapt to flexible work styles, and even though I embrace it because I'm in marketing and
Right. You
obviously
have
that's
to.
just
Yeah.
that's just where my world goes.
Yeah.
It is shocking to me still when I try to comport where I came from because
Mhm.
I even told a story to Ian, one of the guys, here in the company. He was saying, we're talking about opportunities. And I said, you know what's funny? When my manager asked me to work late early in my career, I viewed it as opportunity, where today we view it as impinging on my work life balance.
Yes. Which is
And
what
I
everybody
laughed
strives for. Yep.
and I was like, work life balance is, and I think it's a myth. I think when people say work life balance, what they really mean is life balance.
Mhm. Mhm.
I never want work to interfere in my personal life. It's funny because I've really had to do a lot of work to understand that the world can still function. There are still hard workers out there. They're not trying to take advantage of me. But like, I have gone through a journey as a business owner of like, when I look at people today in the workforce and I looked at what I did, I'm grateful they didn't have to do what I did. But it does feel shocking from a P&L perspective. I must
Yeah.
say the percentage of money that I spend on staff and salaries and benefits is higher than it's ever been. Now, paradoxically, the company in 2024 is more profitable than we've ever been.
Right.
And that's where I'm a believer,
Lean into it.
but it really took a lot of personal work for me to not be bitter about what I had to go through versus what they had to go through today, and somehow comport that I can still be profitable in these other things. And it's got to be hard for those dentists.
Yes, especially, and the way I've kind of reiterated it too is, yes, value of time, value of work, kind of the whole work-life balance theory has certainly shifted. And what's been interesting to watch too, when people talk about the hiring of dental hygienists, especially, and even dental assistants, but there's been that shortage. Really, what we're seeing is the first cohort of baby boomers has been retiring the last couple years. And so that's kind of what's led into that, which also means a shift, kind of the same thing I was talking about before, where there's been a lot of people who, well, I've been working at the same dental practice for the last 20 years, where you just don't necessarily hear that anymore. People are like,
No.
all right, couple years and I'm on to the next, kind of a thing. Where I think that's the shift and the struggle, is that a lot of those, like, I guess, values aren't necessarily there anymore, where that generation that is now starting to retire, yep, this is what I'm doing, I'm fine doing this, kind of really regimented in their day-to-day life and work. We're now, especially the new graduating class coming out, where, well, this is my expectation. I heard that you can make this and that and do that, and then I can still do this and still go on, I want to go on vacation whenever I want. Where they're really, that's where we kind of have to match and be like, okay, let's be realistic. Like, we understand times are changing, shifting, values are shifting, and that's something that kind of, especially if you're a long time dentist, that you're like, well, no, the rest of my team, that's not what they value,
Mm-hmm.
that's not what they want. People, they're not
Yeah.
driven
I,
in
I
that sense.
I find I feel jealousy or envy. I don't know which one is accurate, but one of them, because I'm like, you're asking for things that I didn't have until I built my own company and put
Correct.
my own money at risk and dang near got divorced to fight for the freedom I have today. And
Right.
you just graduated school and you're kind of made it.
Mm-hmm.
I feel this like sense of jealousy of like,
Mm-hmm.
hey,
I
why didn't I
wanted
ask
that
for
when I
that when I
graduated.
was not, yeah, in 1995, why did I not have this? And
Yeah.
but it is the way of the world.
It is. Well, and even,
And
I mean, I graduated in college in 2011, and when I started clinical, and then even like now, is insanity. It's
Mm-hmm.
crazy the
Mm-hmm. Mm-hmm.
difference, even in that amount of time, that it's just, so that's kind of been the struggle, is where do we cap that? Where do we just kind of say like, okay, yes, I hear your desires, but from a business standpoint, from a patient care standpoint, where can we kind of lay the foundation of like, this is reasonable, this is how you get what
Mm-hmm.
you want, but and then just make sure that everybody's feeling respected, because again, that goes down to retention. And are you going to lose another team member because you tick somebody else off? And so
Yeah.
it's ever changing, and it's kind of what my job is, to just try to stay, not only relevant with the clients I work with, but even a titch above, something dramatic. Like what could
Mm-hmm.
stand out
Mm-hmm. Mm-hmm.
extra that's not thought of yet, because you just want to try to stay ahead of the curve within reason, of course.
As I hear you talk and I think through our own journeys, we are at a paradigm change in dentistry in today, because the private equity money that's coming in, they are taking care of their hygienists and they are paying their staffs these things. And they're doing it because they see that employee turnover is notoriously expensive. And I mean, 3 to 10 times the cost of a salary is what it takes to replace them, depending on, what number you look at, right? So massive
Right.
thing.
Yep.
And I feel that in dentistry, where there are these factors converging, right? The labor market is one, and then there's the private equity funds that are coming in. And then there's this, if you're a provider, a dentist today, and you're trying to optimize your P&L at the bottom, you're probably already losing.
Mm-hmm.
You need to be focused on growth,
Mm-hmm.
because that's what everyone else is focused on. And to do that, you have to lean into leadership training or cultural training, because,
Exactly.
as you're talking through your point, I cannot add the benefits, and I think they're important and valid in 2025. I can't bring hygienists on at these higher rates and still operate the way I was. And that
Correct.
requires change, and that requires courage
Exactly.
and personal work.
Mm-hmm.
And Erin, you sound like you might be, instead of recruiters, like a therapist.
I try. Well, that's just it. Is the first step, honestly, is reaching out to me and being like, look, this, gone are the times where you list a job and then you just wait for somebody to apply.
I love those. When those
That
come
was
back, I
great.
will be
It was
excited.
easy. It was great.
Uh-huh.
And so
Mm-hmm.
that kind of goes hand in hand with those providers and practice managers that are still in that mentality. And like, why am I not getting an applicant? Why am I getting no candidates when a practice down the road is getting 16?
And he's not even a good dentist.
Right.
Yeah, he sucks. Yeah, all the time. Yeah.
But so that's kind of that shift too, which, if I can get myself out there and be like, look, my goal is really to take that pressure off of, because it's exhausting. Hiring somebody looking for someone's exhausting. So my mission is basically to alleviate those hiring headaches for practices, allowing doctors and practice managers focus on dentistry, focus on your front office team, focus on, back to the work-life balance, focus on your family at home, like being able to kind of transition those duties onto me. And that's where I come in. And if you, first start reaching out to me, and then I give you kind of these ideas, and you're like, either goes one of two ways, like absolutely not, or okay, tell me more, that's where it can shift, where it's, if you're just going to be very set in your ways and, well, this is how I see my practice, this is how, which is great. I mean, to be a practice owner, any business owner, you need to have that drive, but you also have to be open to the constant shifting and the constant changing and the constant, this is just how to get, not only, you don't want just a body that, at your practice, you want somebody who's actually going to fit and actually going to kind of take on that whole encompass of your practice.
God bless you. It sounds like you're doing really hard work out there.
It's difficult, but it's very rewarding though, when you do get a lot of projects and clients come in and people are like, oh my gosh, like I can go home and just have dinner with my family and not even think about it. And I know it's taken care of. And, I build those relationships with not only clients and practices, but people who I've had speaking engagements with, or people who I've interviewed in the past, and they're like, well, maybe this one doesn't sound like a right fit, but keep me in mind for the next one. And then that's in my back pocket for the next office, and so, yeah, it's challenging. It's ever evolving, but I think kind of what's in my benefit a little bit too is that I have that clinical provider experience and front office experience. And so I can see it from both ways, where it's like, what's reasonable as a provider, what's reasonable as to make a practice run. So
Well, lovely. Well, Erin, thank you so much for your time. And if you're listening
my
and you
pleasure.
want to recruit a great team, you need to call Erin, Dental Recruiters. I've thoroughly enjoyed talking to you, and I love the grasp you have on the market, because we're seeing this is the world we live in,
This
and
is the world.
you can hide and shrink, or you can bear hug it and grow. But
Exactly.
one way or another, it's happening.
It's happening. And that's just it, is you can dig your feet in, or, dig your heels in and say, not changing, going to stay in my ways. But ultimately the world's, you're going to crumble under it. We got to stay ahead of it. You have to evolve.
You do.
Yeah.
Very well said.
Yeah.
Erin, thank you so much for your time. And
My
that was your
pleasure.
bite of dental marketing. Yeah.